Today we will discuss our findings that the percentage of sperm that capacitate prospectively predicts pregnancy and identifies reduced fertilization capacity in a high percentage of men considered normozoospermic by traditional semen analysis. Historically, infertility was often viewed as a women's health problem, although men are known to contribute to approximately half the cases. Current semen analyses are not predictive of male fertility. Men questioning their fertility are often characterized as normozoospermic and eventually given a diagnosis of idiopathic infertility. To address this great clinical need, many have called for the development of a test of sperm fertilizing ability. In a series of publications, CAP score has been shown to reflect capacitation status at a single cell level and functionally assesses male fertility by evaluating the ability of a man's sperm to fertilize an egg. The top right image shows 2 non-capacitated sperm that would be unable to fertilize and 3 capacitated sperm which would be fertilization competent. The histogram shows the CAP score distribution for a population of fertile men. The relationship between CAP score and a man's probability of generating a pregnancy, or PGP, was defined previously using 124 clinical pregnancy outcomes within 3 or fewer cycles of intrauterine insemination. Logistic regression generated an equation that transforms CAP score into PGP. The data were obtained from 5 clinics and across a wide age range of women undergoing IUI. The predictive power of CAP score was prospectively tested using real-world clinical outcomes obtained from typical patients at 6 clinics. In 128 couples for which we had clinical pregnancy outcomes over 3 cycles, there was a 1-to-1 relationship between the number of pregnancies predicted and the number observed. To evaluate the predictive power more precisely, we then rank ordered the results by CAP score and evenly divided them into 5 groups or quintiles. The observed and predicted pregnancies within 3 cycles were determined for each group. No difference was detected between observed and predicted pregnancies across the quintiles as shown by a chi-square analysis. The fit of the original predictive model was tested by combining the new and previous outcomes and calculating a new model. Only a 2.4% change in the predicted PGP was noted from the original model, and fit improved with most changes occurring for the extreme low and high CAP scores. Despite the potential for introducing noise from data and outcomes obtained from multiple clinics, there was little discernible change. These observations substantiate the association between CAP score, sperm function or fertilizing ability, and a man's ability to generate a clinical pregnancy within 3 attempts. The Akaike Information Criterion Test, or AIC, was performed to evaluate whether the inclusion of 1 or more traditional semen analysis parameters would improve our ability to predict PGP. Briefly, the AIC penalizes increasing model complexity without a reciprocal increase in fit. Lower AIC values reflect the most appropriate models. CAP score alone was found to provide the optimal model for predicting a man's ability to generate a pregnancy, underscoring that capacitation serves as the primary metric of male fertility. To evaluate whether the percentage of capacitated sperm within a man's ejaculate differed between men questioning their fertility and those with proven paternity, we compared CAP scores generated from 2,155 clinical samples at 22 urology offices or fertility clinics against CAP scores from a cohort of men with known fertility. The CAP score distribution was significantly lower for those questioning their fertility, with 81% falling below the fertile mean. This result clearly demonstrates that men questioning their fertility are likely to have sperm with impaired capacitation. Traditional semen analysis measures do not predict capacitation ability. These scatter plots show no relationship between volume and CAP score. Small but statistically significant relationships were found between CAP score and motility and between CAP score and concentration. Motility was found to contribute approximately 2% to CAP score, and concentration was found to contribute approximately 1% to CAP score. To assess the relationships of CAP score, PGP, and semen analysis measures in men questioning their fertility versus fertile men, semen was collected from 2,155 men questioning their fertility. Of these, semen analysis was available for 1,948. For comparison, data from a previously defined cohort of 76 fertile men was utilized. 61% of all men questioning their fertility were considered normozoospermic based on WHO criteria. Of these normozoospermic men, 64% had a probability of generating a pregnancy, or a PGP, of less than or equal to 39%. In contrast, only 25% of fertile men scored in the same range. In other words, CAP score identified impaired capacitation in men who were otherwise normozoospermic and would likely have been diagnosed with idiopathic infertility. To determine whether CAP score's predictive ability held true across maternal ages, we disaggregated the data into the maternal age ranges as indicated. No difference was observed between predicted and observed pregnancy outcomes across the maternal age groups. Although female age and fertility are indisputably linked, in women pursuing IUI, sperm capacitation accurately predicted whether a couple would become pregnant across maternal ages. Sperm capacitation ability accurately predicted a man's probability of generating a pregnancy and thus provides clinicians and patients with new insights on male fertility that can inform discussions regarding a couple's best pathway to parenthood. CAP score alone was the best predictor of whether a couple would become pregnant within 3 cycles, indicating that capacitation serves as a key male fertility metric. Reduced sperm function or fertilizing ability is common in men questioning their fertility and cannot be detected by semen analysis. These data from 22 clinics show that a test of sperm capacitation offers a powerful complement to semen analysis, capable of identifying reduced sperm fertilizing ability in men otherwise viewed as normozoospermic.